Okay, today's class is about it's a continuation of our previous class, which you have already seen in my videos. In the previous class, we discussed some terminologies and also some applications of the pharmacokinetics regarding clinical pharmacokinetics and its uses, and then how the clinical pharmacist working in the hospitals and what are the parameters where the clinical pharmacokinetics involved. In our previous class, we discussed about the clinical applications in which we check either the concentration of drug which is present in the plasma and also the drug amount which have the available for the therapeutic effect and the amount of drug which is eliminated from the body. These are all the parameters. If we discuss with the patients, then we will say these type of the studies, these type of the kinetics are clinical pharmacokinetics. Among the clinical pharmacokinetics, there is another branch which is called toxicokinetics. Toxicokinetics means we have to check the toxicology of the drug. And in the previous lecture, we construct different levels. You people know there are the 5 different levels where the drug exists. One is subtherapeutic. The drug is present in the body. We can calculate, we can estimate the amount of drug present in the plasma, but this drug is not useful for the patient. This category is subtherapeutic. Another condition is partially therapeutic. Partially therapeutic means drug is present in the body, but it has minimum therapeutic effect. And other is therapeutic level. Next is partially therapeutic level. Partially toxic level. And last one is toxic level. How we can say this is a subtherapeutic? We have to check the amount of drug in the plasma in other areas. We will discuss in this class different areas, different ways of the drug estimation from the body. In case of partially therapeutics, drug have some therapeutic effect, but it's present in the body but have the minimum therapeutic effect which is not the required one. The required area is therapeutic level. In case of therapeutic level, we have the 2 minimum ranges. One is minimum effective concentration, we will say MEC, and other is minimum toxic concentration. Our target is, being pharmacist, drug should be present in the therapeutic range. And in the therapeutic range, it should not comes into a therapeutic range and then go down. No, we will have to maintain the concentration in the therapeutic level, in the therapeutic area. Here we use 2 words. One is therapeutic window and other is therapeutic index. When we take the difference of these values, MTC and MEC, we will say this is therapeutic window. And when we take the ratio of these MTC and MEC, then we will say this is therapeutic index. Some drugs have very therapeutic, less therapeutic index. We will say these are the narrow therapeutic index drugs. And some drugs have wide area of the therapeutic level, and we can maintain their therapeutic level by adjusting the dose, by continuing the different concentrations and different dosage form of the therapeutic level. Now, our topic of concern is toxicokinetics. In case of toxicokinetics, we have to study the toxic level. When we study the level which is not required in our body, okay, this level is obtained are achieved by the some different factors which may be physiological factor of the patients or the some factors of the drug. For example, if the patient physiology is not normal, just like a normal, then we will assume that drug is not properly metabolized, drug is not properly eliminated from the body, and drug is getting accumulated in the body. And when the drug is accumulated from the in the body from single dose, in the next dose the accumulation will again increase the amount in the increase the concentration in body, and then third dose will also increase the concentration of drug in the body, and the level we will move from therapeutic level to the partially therapeutic level, this partially toxic level. And this partially toxic level is actual some indications, some drawbacks, some adverse effects, and some interactions we can check. Okay, there is the some and other some symptoms which give us the indications of these the partially toxic conditions. But in case of toxic level, where the accumulation gets more and more due to the lack of interest or the lack of proper treatment of the patient, then we will assume that the amount which is now giving some adverse reactions, adverse effect, we will say this level is toxic level. And this study is called toxicokinetic studies, in which we will study the toxic level of the drug. Among them, we will check accumulation of drug and also drug adverse effects. Both of the parameters can be measured or pharmacokinetically or pharmacodynamically, because in our previous studies we have already known in the field of biopharmaceutics we have the two aspects, pharmacokinetic aspects and also the pharmacodynamic aspects. In case of pharmacodynamic aspects, we will check the adverse effect of the drug, and in case of pharmacokinetic study we will check the accumulation of drug. In the study of the biopharmaceutics, we will check accumulation, not only the accumulation but also the fluctuation. If the patient left his dose in a particular time frame, in the particular dosing interval, then we will check the fluctuation and also the accumulation. These are called the toxicokinetics, and this study is toxicology. Okay, next is measurement of drug in the body. Measurement of drug concentration in body. There are the different types we can explain this topic. One topic is, we will divide it into two basic words: invasive and non-invasive. Invasive means those methods which we can apply, which will give us of particular results, and non-invasive means those methods these are the not reliable method. Particularly when we calculate the amount of drug from plasma, blood, serum, we will say we are using the invasive methods. And if we calculate the drug amount from the urine, from the sweat glands, from hair, and from other areas, then we will say these are the non-invasive techniques. We will write first the name where we can check. We can check the amount of drug from milk, from saliva, from plasma, from urine, and direct measurement from biological matrix. For example, biopsy. Biopsy is a technique where we can use some segment of the tissue and then check amount of the drug. And in the case of its instruments, which we are using. One is high performance liquid chromatography and mass spectroscopy. I will first explain these two methods, then we will move towards the invasive and non-invasive methods to calculate, to estimate the amount of drug in the human being, rabbit, plasma, and the other experimental animals. In case of HPLC, when we start with this instrument, we will first of all have to make some particular mobile phase, which you have already known about its working, because we have some particular mobile phase, polar and non-polar, and these mobile phase will give us the amount of drug by estimation of HPLC. We will make first mobile phase and then check the amount of drug. First of all, we have to construct a standard curve or the linearity curve, in which we will take some amount of drug in the plasma, they dissolve it, and then apply this concentration of drug into the HPLC system, and after getting some peak areas, and we will construct a linear graph in which we will have the concentration on x-axis. For example, start with the 10 microgram per ml, 20, 30, 40, 50, then 100 microgram per ml, and we will get the peak area. In case of HPLC, we can use three different ways to construct the linearity curve. One is peak area, other is peak height, and last one is peak width. What they are? For example, I have applied a sample having the drug, and it give me this like peak. The area which is covered, this peak is called peak area. The height of the peak at particular concentration will be called peak height, and the width which will get the peak of particular concentration of drug is peak width. So we can change the y-axis for the construction of the linearity curve, either with the peak area, peak height, or the peak width. When we check the 10 microgram per ml concentration, we get this peak area, then this, and we will construct the standard curve or the linearity curve. This curve is just like the curve which we prepared by using the UV spectrophotometer. What was the parameters when we checked the UV standard curve? Here was concentration, and on y-axis that was absorbance. But in case of HPLC, concentration is on x-axis and peak area is on y-axis, peak height, and so on, peak width. First of all, when we construct this linearity curve, then we will apply our unknown sample. Unknown sample is basically that sample which we get from the patient. When we apply our unknown sample, then we will get the amount concentration. And how can we concentration get? Y is equal to mx plus b. M is the slope, x is the, according to this, concentration in microgram per ml, and b is y-intercept, and y is the peak area. When we use peak width, we will say y is the peak width. When we use peak height, we will use y is the peak height. Okay, from this equation, y is equal to mx plus b, which is the equation of straight line. We should have to understand these values. This b value is basically y-intercept. Why we are saying the y-intercept? It's when we take this type of the line and we extrapolate it and coincide that point is called B, y-intercept. And for the getting of slope, in previous class I clearly explained the use of slope. For slope, we will take the two values. One will be called y1, y2, and same x1 and x2. Formula will be m is equal to delta y over delta x. Simple, because we are discussing with the linear graph, which we have already explained in our labs. Delta y over delta x. We will get slope, it's m. We have b by extrapolating on y-axis, and we have this value y, peak area, because when we inject the unknown concentration, some unknown value, unknown plasma amount of the drug which is present in plasma, then we will get y is equal to mx plus b, and our target is x. X is equal to y minus b over m. This will give us the amount of drug. What the method we will use? Either plasma, either blood, either serum, urine, saliva, milk. These are all the methods. From start of the work, we will have to first construct a linearity curve. Linearity curve or the standard curve of particular drug. Okay, what method we are using? If we are using the HPLC, then we will use these type of the parameter, and same the other instrument we can use mass spectroscopy. This will give us the amount of the drug present in the different substances, just like all these milk, saliva, and plasma. Okay, from this we can measure the amount of drug, and these amount of drug will be used for the sake of pharmacokinetic effect and also the pharmacodynamic effect. Now we will move towards our start of this topic, that was our invasive and non-invasive approaches. We will divide these this aspect into the two main classes. One is invasive method and other is non-invasive method. In case of invasive method, we will use blood, spinal fluid, synovial fluid, and tissue biopsy. In case of non-invasive, urine, saliva, feces, and expired air. These are all the non-invasive approaches. In case of blood can be used in the three different ways. Blood itself, and also we can use plasma and serum. Plasma and serum. There is a difference between the plasma and serum. First one is, when we discuss about the blood have the each and every aspects, each and every materials, blood cells, plasma, proteins, water, all the composition which are existing in the blood. Another is plasma. Plasma having the plasma proteins, but they have absent the blood cells. And in case of serum, blood cells are absent and also some proteins, likely fibrinogen. These are absent in the serum. And in case of plasma, albumin and other proteins, plasma proteins are present, water, but without blood cells. Okay, how can we obtain plasma or serum from the patients? When if we take the blood of the patient and we clot it first, after getting the clot, we will remove the clot and the remaining material, we will centrifuge it, and the remaining material will be called serum, because we have not added any anticoagulant. Simple method, if we have, there are some three test tubes. One will be called blood. It has blood cells, proteins, water, and all other components. It's blood. Plasma. It has plasma proteins, water. Now, serum. In case of serum, we have simple water and other components except plasma proteins. By getting the plasma, we have to use some anticoagulants, EDTA, heparin. These are two anticoagulants which we can use before getting the plasma from the blood. And in case of serum, we will not use any anticoagulant. We will clot it first, and after getting the clot, we will centrifuge it, removing the clot, and the remaining material will be called serum. Okay, these are the some already I have known about the about blood. How many parameters we can check by the blood is MEC, MTC, drug intensity. The word intensity should also be explained. When we make plasma concentration curve, time, plasma drug concentration curve, we will get this like behavior. And we have one is MEC, other is MTC. And the level from the start of the MEC to the end of the MEC is duration of action. Duration of action. And the height which we get after the single dose is called intensity of drug. Intensity of drug. Okay, by calculating the amount of drug from blood, plasma, serum, we can check how many parameters. We can check the pharmacodynamic parameters as well as pharmacokinetic parameters. Mostly the pharmacokinetic parameters which we can measure are area under the curve, MEC, MTC, intensity, duration of action, and same therapeutic window, therapeutic index. These are all the parameters we can check by using the blood, plasma, or the serum. Okay, another is drug concentration from the tissue. Same for the spinal fluid, from the synovial fluid, just like a blood, we will first make standard curve, and by using the HPLC or the mass spectroscopy, after getting the standard curve, we will measure the unknown concentration of the drug which is present in the spinal or the synovial fluid. In case of tissue biopsy, which is the invasive method, we will get some parts of the tissue and then observe the amount of drug which is present in that area. But these processes will not give us the complete behavior of the drug, just like the plasma. Why it's not giving us the complete behavior? Because our tissues are not homogeneously, they have the cellular nature. They have the heterogeneous cellular nature. When they have the heterogeneous cellular nature, some cells behave some different like, and when we'll take the some parts of the tissues from where we are observing the amount of drug, we will just assume that the particular drug is present in the tissue and it's effective for the same tissue, but it's not spread whole tissue. But the biopsy is actually a technique which is, we can say, the latest technique when we are discussing the organ to organ variation, particular tissues variations, and amount of drug which are spreading from the circulation to the tissues. These biopsy techniques are considered most important. In the case of biopsy, it will give us some information regarding the chemotherapeutic drugs. When we are using the, in case of cancerous patients, the biopsy technique can be considered much better as compared to plasma, because there is some amount of the some drugs having the more affinity toward the cancerous cells, and when they are moving toward that area, then we want to measure the concentration of in the particular site, we will use the tissue biopsy. And in case of drug present in urine, now in invasive method. In case of urine, feces, expired air, and saliva, these are called the basically invasive method. These methods are not getting some much importance in our field, but we have to study all these. In case of urine, we will have to collect the whole urine of the patient at the particular dose. For example, if we want to check the amount of drug which is eliminated from the body through urine, we will have to first calculate the amount of drug which is present in 1 ml. And for this, we will have to check first amount of volume, the volume of the urine, and then we will calculate the per ml concentration by constructing the same linearity curve of the urine data. Then we will measure the amount of drug at particular time areas. In the case of urine, we will, in our future classes, we will learn about the ARE method, amount remaining to be excreted. We will convert it into our kinetics profile. We will divide the portion of the drugs into 2 segments. One segment is the drug which is coming from the urine, and we can calculate from the urine. But the remaining drug is present in our body, and we will work on the ARE method, in which amount remaining to be excreted, that amount which is present in the body and which is not eliminated from the urine, we will calculate and then make some kinetic profiles. Another are the rate constant method. These 2 methods we will apply in our future classes when we learn about the drug calculations through the urine. And in case of saliva, we can measure the amount of drug our salivary glands, because it totally depends on the pH and the pKa values. In our in the particular case, we will study in our future classes pH partition theory. This theory is about the pKa of drug and pH of the body. pKa and pH of the body are basically 2 parameters which will decide either the drug is present in the saliva or not. First of all, we will assume that the drug is in equilibrium in the plasma state. If the drug is present in the equilibrium in plasma state, then the calculation through the saliva is important. If the drug is not in equilibrium and drug is just absorbing from the body, from the GA system toward the systemic circulation, then the salivary secretion will not be considered so much important. And in case of another way of the drug is purpose is forensic drug measurement. In the case of forensic drug measurement, especially those people who are working on some criminal cases and they want to measure the amount of drug, is this casualty is due to the some amount of drug or some different conditions in which the drug is involved, where we can check some drugs, especially the concentration of opioids through here. And for the sake of opioids, we use gas chromatography. Gas chromatography techniques will be used in the case of forensic drug measurement. Forensic drug measurement can be to check the amount of drug through nails, through hairs, and some other areas through skin. And these are the particular uses of the measurement of drug concentration in our body. And what are the significant? Their significance are pharmacokinetically significant and pharmacodynamic significance, and their concentration, especially in the case of cancer chemotherapy, and then electrophysiological means ECG, and their other uses are some particular drugs where we are taking some measurement by using the insulin, by using some anti-cancer drugs, and some other clinical endpoints are the basic parameters which will give us the idea and its significance. Thank you very much.